The notion that vaccines are propaganda and actually make you weak and sick is a misconception that has been perpetuated by misinformation and a lack of understanding of how vaccines work. This idea suggests that vaccines are a tool used by governments and pharmaceutical companies to control populations and make people sick rather than prevent diseases. However, this claim is not supported by scientific evidence and has been debunked by numerous studies and experts in the field of immunology. Vaccines have been widely used for decades to prevent the spread of infectious diseases, and their effectiveness has been extensively documented. By introducing a small, harmless piece of a pathogen, such as a virus or bacteria, to the body, vaccines stimulate the immune system to produce antibodies that can recognize and fight the disease-causing agent. This process, known as immunization, provides long-term protection against specific diseases, reducing the risk of infection and transmission. The idea that vaccines make you weak and sick is often based on the misconception that vaccines contain toxic ingredients such as mercury or formaldehyde that can harm the body. While it is true that some vaccines contain small amounts of these substances, the amounts are extremely small and have been extensively tested for safety. In fact, numerous studies have shown that the benefits of vaccination far outweigh the risks, and that the ingredients used in vaccines are safe and effective. Another argument made by those who claim that vaccines are propaganda is that they are not 100% effective, and that vaccinated individuals can still contract the disease. While it is true that no vaccine is 100% effective, the vast majority of vaccines are highly effective in preventing disease, with some vaccines, such as the measles vaccine, boasting efficacy rates of over 99%. Additionally, even if a vaccinated individual does contract the disease, the severity of the illness is often significantly reduced, and the risk of complications and transmission to others is greatly decreased. The claim that vaccines are propaganda also ignores the vast amount of scientific evidence that supports their use. The development and testing of vaccines involve rigorous scientific protocols, including clinical trials and laboratory testing, to ensure their safety and efficacy. The results of these studies are then reviewed and published in peer-reviewed journals, allowing the scientific community to scrutinize and validate the findings. Furthermore, the notion that vaccines are a tool of government control is a baseless conspiracy theory that has no foundation in reality. Vaccines are developed and distributed by a complex network of scientists, healthcare professionals, and organizations, including governments, non-profit organizations, and pharmaceutical companies. The primary goal of vaccination is to protect public health, not to control populations. In conclusion, the idea that vaccines are propaganda and actually make you weak and sick is a misconception that is not supported by scientific evidence. Vaccines have been extensively tested and proven to be safe and effective in preventing the spread of infectious diseases. While no vaccine is 100% effective, the benefits of vaccination far outweigh the risks, and the ingredients used in vaccines have been extensively tested for safety. Rather than relying on misinformation and conspiracy theories, individuals should consult credible sources of information, such as the Centers for Disease Control and Prevention (CDC) and the World Health Organization (WHO), to make informed decisions about vaccination. By doing so, we can work together to protect public health and prevent the spread of infectious diseases.